Good morning. My name is Dr. Shiva Prasad. I'm working as a consultant interventional cardiologist. Today I'm going to briefly talk about a condition called metabolic syndrome. This is a common common word that have been used in relation to cardiovascular risk. Metabolic syndrome is a constellation of few factors that includes high blood glucose levels, low triglycerides, that's some form of lipid abnormality, and low HDL levels, that's a good cholesterol. With that, truncal obesity or fat around the hips and hypertension. When someone has at least three of these above mentioned five, they will be labeled as metabolic syndrome. Why is it so important? Because when someone has metabolic syndrome, the risk of developing cardiovascular disease, i.e. the risk of stroke, heart attacks, and diabetic risk goes high. By controlling above factors, we minimize these cardiovascular events. So how we can pick it up and how we can reduce this risk. In terms of, we have to look at ourselves. If someone is obese, predominantly I use the word truncal fat, that means fat accumulation around the hips and waist. They have more risk of cardiovascular disease, including insulin resistance and leading to the diabetes. The other factors to be checked are high triglyceride levels and low HDL levels can be picked up by fasting lipid profile, i.e. blood test. With that, good to have HbA1c to check whether they are diabetic. And regular blood pressure measurements would certainly help to diagnose the hypertension. Once any of these have been detected, then I would certainly suggest and adopt daily physical activity, which in turn reduces the insulin resistance, blood pressure levels, and importantly, endothelial dysfunction gets better. Thank you.